What if healthcare wasn't rushed? What if your doctor knew your name, your story, your family? What if medicine felt human again? Welcome back to Release the Kraken. I'm your host, Steve Brickner, CEO of Kraken Technology Solutions. This is the podcast where we talk about business and leadership and community and the people who are bold enough to build something better right where they live. So today's episode hits really close to home, literally and figuratively. We're talking about healthcare, trust, and rebuilding a broken system. Not from a boardroom, but right from Winter Haven, right here where we are. So my guest today is Dr. Kara Lampfer, founder of DirectMD, a practice built on a simple but powerful idea. Patients first, relationships first, no insurance middleman. She's a physician, a builder, and a community member, and someone who chose to step away from the way it's always been done to do what she believes is right. Dr. Kara, welcome to Release the Kraken.
Hey, Steve. Thank you so much for having me today. I'm really excited to be here.
I think we're going to have a great talk. I think this is something that a lot of people in the community really need to understand better.
For sure.
And healthcare has become a hot topic for the last several years because of the cost and expense that's associated with it. But before we really talk about medicine, let's talk about Kara the person. Did you grow up in Winter Haven?
Oh, man. Yes, I did. I'm born and raised from Winter Haven. I'm actually so Winter Haven that I was the first baby of the new year at the Regency in 1992. People like to know that I went to Brigham Academy. I went to Jewett Academy. I went to Lake Region High School, all before I went up to University of Florida. So I am a Winter Haven girl through and through, and Winter Haven's it's really special to me.
Awesome. That's great. Yeah, I'm the same. I was Brigham. I was Brigham before it was an academy myself,
Yeah.
but Brigham, and then went back over to Westwood and Winter Haven High School, and then never even left to go to college. It was Polk State for me.
That's right.
So was becoming a doctor something that you always wanted, or was there a moment that really moved you in that direction?
Oh, yes. I would say I always wanted to be a doctor. Medical school is really tough. It's really tough. But I always knew I would be different. My degree is actually in public relations. You'll find most doctors, their degrees in biology or chemistry, but I just really love people. And, I counted up how many times I moved around to be a doctor. So from med school all the way through residency, and it was 17 times. And, each move, my parents would be like, do you really want to do this? It's a lot. And I'm like, I do. I just really do. So yeah, I always wanted to be a doctor.
Yeah. Medical and residency are really intense. What did those years teach you, not just about medicine, but really about people in general?
Yeah. Reflecting back through my training and just the years of going through medical school and residency, I learned that people are a lot braver than you think, and they're battling things that you would never know about. People have intense grief and trauma, and they have caregiver burnout. I did most of my training actually in New Jersey.
Oh, okay.
During the height of the COVID pandemic. So at that time, a lot of the schools here were closed to students. So I actually got sent up there. They really needed doctors. And my first day ever in the hospital ever. So I had no real skills. I had just had 2 years of book work. And my very first day, I got put on ICU wards in the pandemic. And I was handed a long list of patients, probably 40 patients. And the attending was like, go do what you can. Just go to that floor, help out, see what you can do. And I got up there to the floor, and the intern, which is a first year resident that I was with, he was like, Kara, all we do all day is CPR. We do compressions. We're changing vents. We're flipping patients. We're switching the IV lines around. So do what you can with that. And so I would. I mean, every 15 minutes we were doing chest compression, just switching out. And by lunchtime, my entire list had died almost every day. It was soul crushing. It really was. And at the end of the day, just that heaviness on your chest, you felt almost deflated, like, "Oh, man, is this for me?"
Yeah.
And still, even after all that, you still have to call the families and let them know what happened and that their loved one didn't make it. And I really saw, the worst of humanity there, and I saw some of the very best.
Yeah.
Because even these families who lost their entire family, and I mean that, they lost their kids, they lost their parents, they lost their grandparents, and they would still make us food and bring us food in the
Yeah.
hospitals, and they would just thank us for everything that we did and everything we tried. And that just taught me that people are really, they're doing the best they can with what they have.
Yeah.
And really, any simple act of kindness that you give to someone, they can remember it forever.
Yeah.
And that's probably outside of medicine. I mean, those instances, I that really taught me a lot of medicine really fast. But it taught me a lot about humans and
Yeah.
people,
Yeah.
really.
Yeah. Yeah. A lot of times, somewhere along the way, doctors realize that the system really doesn't match the reason they got into medicine.
Yeah.
Um, so, was there a moment that you realized that the way things are done really doesn't align with the values that you bring into your desire to do medicine?
Yeah, I'm a people person. I really love people say that all the time. I'm a people person, but
Right.
I really do just love taking care of people. And I will say it started when I started. When I started at an outpatient clinic, I would go in to see a patient and I'd sit down and I would say, "Hey, how are your kids doing? How's that new dog you got? Are they potty training okay? How was that wedding you went to? I know your kids got married."
Right.
And we'd sit there and talk. And before we'd even get to the medical part of it, there'd be a knock on the door. "Dr. Lamfer, your next patient's waiting. You got to get out of there." And it's just not an environment where you can care for people the way
Right.
you want. And
Yeah.
doctors are just pressed for time because we have to see so many patients in a day. And so it really started when I started.
Yeah. Yeah. So you immediately noticed that the way the system's going, patient care is not necessarily care anymore. It's a process, and
Yeah.
it's kind of sad. I remember as a kid, you go in and you talk to the doctor, and he ask you how you're doing and how mom and dad's doing, and this and that, and now you're a process. You're a piece of that. Um,
I
just a
remember.
workflow.
Yeah. Hmm.
So that brings us around to DirectMD. Can you tell us about the DirectMD model, just in plain English that makes sense to everybody, and kind of makes it easy to understand the benefits of how you're doing things?
Yeah, with DirectMD, so we're a direct primary care practice. And to me, direct primary care is the solution to the broken healthcare system. So what it is, it's a monthly membership-based model of healthcare.
Okay.
It's really just a different way of thinking about receiving your primary care. So you pay a low monthly fee and you're a member. And so you get unlimited virtual visits, unlimited in-person visits, same or next day appointment scheduling. You also have direct access to the doctor, which is me.
Right.
So you can text me, call me, telehealth me, portal message me, email me, whatever is easiest for you, and
Right.
you get me on the phone. So
Right.
there's no more of this calling a call center or finding a front desk person to talk to, and then they schedule you hopefully in 6 months. You never know. But I will say that the self-schedule feature is a favorite. A
Yeah.
lot of the patients can't believe that they can just get on an app, see my entire calendar, and say, "Hey, you know what? Tuesday at 2 works for me." And they just take that appointment slot.
Yeah. Takes a lot of that extra effort out of
It
making.
does.
You don't have to get your mom to call and make a doctor's appointment
Yeah,
for you anymore. I mean,
exactly.
that's pretty amazing.
Right, right. And
Yeah.
it makes a lot of other things a lot easier too.
Right.
I would say, half my patients have insurance and half don't.
Right.
And we have what's called client billing with the labs and imaging
Mhm.
places that are local. And so our prices are even better than cash prices.
Right.
So even there, we have a lot of cost savings for patients.
Yep.
And that's really the model of direct primary care, is to make it affordable,
Hmm.
accessible,
Right.
and have that connection again. Like you
Yeah.
have that old timey hometown doctor
Right.
again.
Yeah. And it's tough because there are a lot of different views out there, but everybody deserves great medical care. And do I think it's the place of the government to provide that? No, I don't, because, what kind what kind of care do you think we're gonna get if we end up doing something, socialized? I don't think it's gonna be good. But as we move into something like this, I think you're seeing a lot of benefits. Um, when I was a kid, we didn't have medical insurance. It was
No.
you go to the doctor, you pay, if it was more expensive, they let you make payments on
Mhm.
it. And it was just a different time.
Right.
And I think, when they came out with these HMOs and things like that, it was just a grab to make huge amounts of money. Insurance is not one of my favorite subjects anyways, but what benefit do you see to remove insurance completely from the equation of your primary care doctor?
Yeah, so, like I said, half my patients do have insurance, half don't. And you could say in the direct primary care model that we've broken up with insurance.
Right.
That's what I like to say, but we still play nice with them in the sandbox. So there's instances where insurance does play a part in the game. And some of those instances would be like catastrophic events. If you had to go to the hospital for some reason, if you had an accident, cancer, unfortunately, those
Right.
treatments are really expensive. That's where insurance really comes into play. And with the labs and imaging, the billing that we have, the pricing that we have, it really makes a lot of sense to not use your insurance because the pricing ends up better. But
Right.
some patients do opt to use it, especially my patients who have Medicare. They'll use the Medicare to see specialists, they'll use it to um, pay for labs and imaging. But I will say, even specialist visits, you would be surprised. Even if you pay out of pocket for those, the cost savings are real. Like just last week, I had a patient, I needed to call around and find OB care for her. So I called all around and there was one office affiliated with Lakeland Regional. And I asked him, hey, I have a patient totally uninsured. What can we do here? She needs prenatal visits. We need ultrasounds. We need delivery. What's the cost? And the lady on the phone was like, oh, we do have payment plans. And I was like, give it to me straight. What is it? And I'm bracing myself. And she said, it's going to be a little under $4,000. And I thought, just for the delivery, right? And she said, no, for the visits, the ultrasound, the delivery. She's like, anesthesia, I believe some is included, but there may be an extra cost. But I thought, my patient had told me the last time she gave birth, she paid more than double that with
Mhm.
insurance.
Right.
So it's just shocking.
Right. Yeah. And then when you think about the fact that you're paying 4 or 5, $600 a month for insurance premiums just for
Mm,
one person,
yes.
you're like, now wait a minute.
Wait a minute.
Wait
Wait
just a
just a
minute.
minute, right?
I can negotiate prices to be
Yes,
lower than my insurance premiums
correct. You can.
and get better care
Yes.
because the doctor doesn't have to deal with fighting with insurance companies.
And that's one of the big things is that I noticed when I was in the fee for service world is that we spent, I would say 80% of our time documenting and writing these long notes and billing codes and just to get insurance to reimburse us just a little bit that they might.
Right.
And that reimbursement every single year became less and less.
Right.
And that's the reason that doctors are kind of forced into this process, as you said, of having to see more and more patients. And that means I have less and less time per visit. And then I spend all hours of the night on the phone doing prior authorizations and calling the pharmacy, trying to get medications approved and doing peer to peers.
Right.
So it's on, and really, it's a broken system that we're in.
I agree. I agree. So, do you think that just eliminating, you know, fighting with billing codes and things like that, do you think that in and of itself gives you a better opportunity to take care of your patients and at a lower cost because you don't have to hire an insurance specialist to fight with that?
Right.
Yeah.
Yeah, and taking out the insurance aspect of it, you're really giving yourself more room to create that connection with the patient. My visits, they can be as long as you want or as short as you want.
Right.
My whole idea is that you know me, and when you come in here, you're visiting with an old friend. That's
Right.
how I want it to feel.
Yeah.
Is that you're comfortable. You don't hesitate to reach out and say, "Hey, doc, I really need this," or "Hey." I had a patient, she was like, "Hey, I woke up, I'm pretty sure I have pink eye, but I'm on my way to drop my kids off." I'm like, "No problem, send me a picture of it."
Yeah.
And because I already know your medications, I know your allergies, I know you. And so I just sent in the medication
Yeah.
and she was like, "You know what? I didn't have to miss work.
Yeah.
I didn't have to miss
And
dropping my
please
kids
keep
off."
that pink eye out of my
Yeah,
office.
right. I'm like, "Yeah, I don't want the pink eye." But, so it just makes it easy. And
Yeah.
she was just able to call in and say, "Hey, this is what happened, and I don't hesitate to call you." So the health outcomes in direct primary care are just fantastic
Right.
when you compare them to fee for service because you don't hesitate. You
Right.
don't have to wait for an appointment 6 months from now. You
Yeah.
can say, "Hey, I can call her today
Yeah.
and let her know I need that
Yeah.
refill."
I
And
mean,
it's just
I
much better.
I agree. I think, I think that kind of leads into the next question. And this model really allows you to practice medicine the way you want to practice medicine without consequence, without detriment to the patient. What do you think? You know, this model, do you see it perpetuating more and more as insurance gets crazier and the talks about, money coming back from the government to buy your own insurance or whatever? What do you think about all?
Direct primary care has really given me the opportunity to practice full scope medicine, which is
Mhm.
why I went into medicine
Right,
and why I chose family medicine ultimately. 'Cause family medicine, we're kind of called the jack of all trades.
right,
We do all kinds of things. We do dermatology, pediatrics, geriatrics, adult medicine, emergency, um, women's care. We do it all.
right.
And in this setting, I am able to do it all.
Yeah,
In one day, I might be doing a sports physical for a kid playing football, and the next visit might be a well woman visit, and the next visit's a biopsy of a weird looking mole. And it creates a lot of variety for
right.
me. And I just create such a rapport with patients. I'm able to go back to knowing them. And with the appointments being however long you want them to be,
Yeah,
typically they choose 30 minutes, but you get that entire 30 minutes with me.
right.
There's no, you got to sit at a vital station and the nurse takes your vitals for a
Yeah,
while and then you have to go and fill out some paperwork. No, you just do everything with me and we just chat the whole time. And
right.
it's really brought me back to where medicine should be.
Mhm.
And I think that direct primary care is the future of primary care.
Yeah,
And with the constraints of the current system, you see a mass exodus of primary care doctors, which is going to perpetuate the shortage that we already have. But in this setting, growing up in Winter Haven, I have seen both sides. I grew up with two parents who own their own businesses. So having insurance, I know, is a luxury. I had my own vaccines done at the health department,
right.
as a kid. And I know there's resources for people who are underserved. I mean, I still volunteer at the Haley Center and I see them all the time. And then there's clinics around here that are fee for service for people with awesome insurance. But
Right,
who's taking care of the people in the middle, which is our business owners,
right.
our tradespeople, or just our people who are plain out frustrated with the whole thing.
Yeah,
So I think that's where direct primary care really shines is we take care of that middle group
yeah,
who they are the backbone of this country, but
right.
we largely don't have the opportunity to take care of them. And this is where we can.
Yeah. So what do you think surprises patients the most when they first join?
Oh my gosh. It's honestly, it's every single patient comes in here. I would say pretty much every single patient comes in here. They sit down and they just thank me for my time. And I think, wow, I'm so grateful to them for coming in, but they just haven't had a doctor who was able to give them that time. And I think it's just so important to have that connection with your patient. And I think that warmth, that feeling of just being able to come in and talk to me and tell me things maybe you wouldn't
Right.
tell other people. I think I've achieved that here.
Yeah,
So yeah,
that's
that's
awesome.
something that surprises people, I think, is just how easy it can be.
Yeah. Yeah.
Yeah.
I think that's fantastic. And, I love seeing it because, you look at the old TV shows back in the day and, and the doctor just knew everybody in town
Yeah,
and they knew what was going on with your
exactly.
life. And it's just a hometown feeling. And,
Yes.
while Winter Haven is growing and, we're working on some fantastic initiatives and around technology and things like that, um, it's still a hometown feeling.
Yes.
And that's kind of what we really love about Winter Haven. So that's I love seeing these sorts of things coming around. So what does it mean to you to build your practice in your hometown?
Oh, it's very cliche, but I could say it's a dream come true. Winter Haven, it's where my family is. Both my parents have been here since they were little kids, and my both of my parents they owned their own businesses here for a long time. My dad owned McGee Tire, my mom owned Amy's Party Store, and for 25 years almost. So we're really connected in the community, and I always say these are my people,
Right,
and I want to take care of them. And who better to show them that it can be done than someone who is one of them?
right.
Which is also something that you don't see a lot either
Yeah.
is a doctor who's from the community, knows the struggle, grew up not having insurance at times and just
Came back anyways.
came back
Yeah.
anyways. Yeah, it was always my goal to come back and take care of my people, so I'm
Yeah.
here.
That's awesome.
Yeah.
So who do you think benefits the most from the DirectMD model? Is it businesses? Is it families? Is it business owners that are looking to give their employees some sort of insurance
Yeah.
or some sort of medical care? Because, we all know that it's become prohibitively expensive
Yeah.
for small business owners to provide that for their employees. Do you think, what's the biggest group that you really see taking advantage of?
Yeah, yeah, that's a great question. I would say the benefits for individuals and families, it really speaks for itself. When I was in the fee for service industry, each doctor was responsible for around an average of about 2,000 to 2,500 patients each. And it was really difficult to be able to give that individualized, personalized care to each person. So in this setting, we really are able to. I see entire families, I mean, top to bottom, grandparents all the way down. I like to say I take care of womb to tomb, so all ages, all genders,
Right.
all ethnicities, all religions. I really do have the entire spectrum.
Yeah.
So for individuals and families, I think the benefits speak for themselves, but I would like to touch on the business aspect. And you're absolutely right. For the businesses here, we have small business owners who have been supporting this community. I mean, they're the ones who sponsor your kids' sport teams.
Right.
They're the ones who are out in the community at the festivals. They're the ones that are here driving the economy in our community day in and day out. Their
Right.
kids go to school with your kids. And really, you're right, it's out of reach. I
Mm.
mean, providing insurance for not only themselves,
Mhm.
but also for their employees. They really want to, but the prices are just out of control
Right.
and they're going to keep climbing. So with direct primary care, it's an excellent benefit that you can offer to your employees at a really low price. So a lot of cost savings with that instead
Right.
of offering traditional insurance. So I have a lot of small businesses who are coming in like, hey, what can I offer to my employees? And we talk about it and they think this is fantastic. What happens is my employees are able to get healthcare in a timely manner. So if they're sick, they're not missing work because they can
Right.
call you. They can come in this morning, which is great for the business too. You're not
Right.
having people, out every day because they can't get a doctor's office
Right.
visit for 6 months. They also can offer it to their family, so the
Mhm.
employee's spouse and their kids can come
Right.
as well. So it's been great. It's something that's improved a lot of employee retention rates. That's what I'm hearing.
Right.
I have, in particular, there's an auto body shop who has it, and they're just saying, I'm the only one in town who has this.
Yeah.
So I keep my guys and I keep the good ones here. They stay because they can provide care to their kids.
Right.
And this is huge. It's
Yeah.
something they've never had. I mean, you were sharing with me earlier that even you haven't had you're a business owner. You
Right.
haven't had a doctor in quite some time. And
Yeah.
I hear that every day.
Yeah.
It's, hey, doc, you know what? I'm so sorry, but I haven't seen a doctor in 21 years. I haven't had labs in 15 years. And I'm like,
Yeah.
oh, you know what? It's okay. Let's start today. This is what it's for.
Get back on track.
Let's do it.
Yeah.
Yeah. So it's been awesome to see that and to give back into the community.
Right.
It's just it's been a game changer.
Good. Awesome. So is there one moment that a patient reminded you, this is why I'm doing this?
Yeah. You know what? I think every single patient reminds me this is why I'm doing this.
Yeah.
I just feel so lucky that they would take a chance on this concept with me
Right.
and trust me with it. I really every single patient,
Yeah, that's
all of them.
awesome. That's awesome. So, clearly you are heavily involved in the community. You said you volunteer at the Haley Center,
Mhm.
which for those that don't know is a free medical service for those that can't afford it. Can you
Yeah.
tell us a little bit more about the Haley Center while we're sitting here?
Oh, I'd love to. I've been volunteering at the Haley Center as a physician since 2022. Excellent service. You're absolutely right. It's a working uninsured clinic. So you come in and you receive medical care from physicians, and they have their own pharmacy, so they're able to offer medications as well.
Okay.
It's an excellent service for people who need it.
Right.
And they come in and there's all spectrum. There's every single type of person you could think of comes in there, and it's just another service that we can offer to our community. One of my greatest mentors, Dr. Atkins, he runs it, and he's just the most awesome physician, and I really appreciate the opportunity to go in there and even learn from him.
Yeah.
I'm also an attending, but he is a really experienced one, and so I get to go in there and learn from him and keep up a lot of my skills
Yeah.
too,
Yeah. A
because
lot of different things,
oh
I'm
my gosh,
sure.
so many things in there. At the Haley Center, they also practice full scope medicine. So
Right.
they do women's health care. They do skin, biopsies, laceration repair. They also do chronic condition management.
Right.
Diabetes is a big one. They really help supply people with insulin
Oh,
and
wow.
different diabetic medications, which is so needed.
Yeah. Yeah. That's really expensive to
Yes,
deal with.
it truly is. Yes,
Yeah.
yes.
So if somebody's frustrated with healthcare, but they're hesitant to try something new, what would you say to them to kind of get them to understand and bring them around to the DirectMD
Yeah.
pathway, we'll call
Yeah.
it?
Honestly, you have to do what's right for you and your family,
Right.
whichever way that is. But if you're looking for personalized, accessible healthcare
Right.
where you can get right in and the doctor knows you, you found it. This
Right.
is it. DirectMD is it. And we have a website you can visit, directmdhealth.com. And you can call or text our phone number too, the 863-400-0622. And with that, what we're doing is we're setting up complimentary meet and greet appointments. So you can come on into the clinic, tour the clinic, see what we've got in here, meet with me, chat, learn more about the direct primary care model, and see if it's the right fit for you. And a lot of times we just get you enrolled on the spot.
Yeah.
But it's just awesome. Once you experience it, you'll never want to go back. You'll be like,
Awesome.
oh man, it actually can be comfortable and fast and
Yeah.
easy to schedule. It really can. So
Yeah.
if you even feel like that's you, come check it out.
Yeah. So with that said, what is one thing that you wish everyone knew about their own health?
Yeah. Something that you should know about your own health. I would say that if you're feeling frustrated with the current system, it's not because you're complicated. It's because you're trying to take care of yourself in a system that wasn't made for it. And you really do have a lot more control than you think, and especially cost savings wise. A lot of people think, oh man, if I want to go see a doctor, I have to have this insurance or I just can't go.
Right.
And that's simply not true. You really can. The cash prices at a lot of places are jaw-droppingly shocking to learn about. But yeah, that's probably what I would say is that you have a lot more control than you think, than we've
Right.
been made to believe.
Right.
Yeah.
Right. And I think a lot of that's perpetuated by huge insurance companies and things like that, wanting you to think you can't afford your own health
Yes.
care.
Yes.
Well, thank you for coming on the show. Thank you for hosting it here in your beautiful office. This wasn't just about healthcare. This is about courage and relationships and choosing people over systems. If this conversation resonated with you, check out DirectMD. We'll put her website link in the description. And better systems don't happen by accident. They happen because people give a damn about their community and they really care about people. So, Dr. Kara, thank you for coming on. And to our listeners, this has been Release the Kraken. We'll see you next time.